Sylvia and me.
Sylvia and
Sylvia
me.
and me. Sylvia and
Sylvia. Sylvia and me.
Sylvia.
Hi, I'm Sylvia Beckerman, host of the podcast series Sylvia and Me, conversations with extraordinary, inspiring women.
I'm Natalia Spierings, and I'm joining Sylvia on Sylvia and Me today.
Natalia, thank you so much. And you are a doctor of dermatology.
Yes.
And in fact, you are you were born in Europe, but then you lived your childhood in the U.S. and then you went to London, where you practiced where you went to medical school.
Right.
I had a little bit of difficulty getting those words. So, and you practice in both London and Dubai.
I do now, yes, for the past like 2.5 years.
Well, that's great. And as I was telling you when we first met just a few minutes ago, one of the reasons why I wanted to talk to you and have you on the podcast and talk to our listeners is because you are exceedingly honest and open about skincare, about what you believe works and doesn't. You don't take the myths that people have up there, and you don't give people false hope, which in today's day and age, it's something that's quite necessary.
Yeah, totally.
And you have a no-nonsense approach to dermatology and skincare. Mm-hmm. And I am going to read something that I got off, which I believe, because it's nothing bad, I got off of the internet, which says that not only you buy coastal, but that means that you combine the style and sensibility of Europe with the quirkiness and energy of London and a positive American attitude in order to provide patients with unique, holistic, modern skincare.
Yeah.
That's right. And that's what I've seen in your blogs and your videos that you put up there.
Cool.
So,
good.
In saying a no-nonsense approach to dermatology and skincare, what do you mean?
So I think to answer that, no one's actually ever asked me that directly. But I think what I mean is, well, it comes from what I've seen happening within the skincare industry. Is over the past few years I've been practicing dermatology as a consultant here, which is like an attending in the States. And I've just seen so much nonsense coming out of people I see on the internet, in magazines, on TV, and also coming from patients. And I don't like to say that my patients talk nonsense, but they're getting that information from somewhere, okay? So I started seeing my patients coming up with a whole bunch of nonsense. And I was thinking, you're not making this up, because you don't, do you know what I mean? They're getting this information from somewhere. And I was like, where are you getting this information from? Because who in God's name would write this on the internet? Because this is so, like, such nonsense. There's so many examples of that. And I started kind of looking at what was happening, and I went on Instagram, which I had never done before. And that was about 2 years ago. And I was just looking at what people are writing on Instagram. And I just thought, what are these people saying? Like, about acne and about acne scars and about collagen supplements and wrinkle treatments and sheet masks and double cleansing. And it became just this, I was horrified, because I'd never seen that side of it before. Because as a kind of a doctor, I'm very medical with dermatology is very medical. I don't know much about what's happening. Well, I didn't know much what was happening in the world of cosmetic skincare, because I pretty much just had it just wasn't relevant, to what I was doing. And then when I saw what was happening, and then I realized that 99% of my patients are seeing this as well, I just thought, oh my gosh, I need to, someone needs it. Why isn't anyone saying anything? So that's why I started. That's where it came
What
from.
I'd like to do is actually go into some of those myths or false information, because I think this is an opportunity to really to put some things in perspective. With to me, a number of things. People are obsessed with what they call anti-aging, which to me is like, it's absurd.
The word itself.
So
Yeah.
why don't you, what is one of the biggest misinformation that is out there?
Oh God, there's so much. I think one of the biggest ones, there's a lot of different topics, but I think one of the biggest ones that's recently become, for just in the past few weeks, become a more of a big issue is the idea that accutane is very dangerous. Accutane as an acne medicine. And I don't know if you, like, oral Accutane is used to treat severe acne. And it's a cure for people. And that's a little bit outside of like cosmetic skincare, but it's actually quite related because Accutane is extremely effective to treat severe acne, and it changes people's lives. But there is so much absolute nonsense floating around, and quite aggressively floating around on the internet, that I have patients who are scared of taking it. And it's worrying that there's like a skin saving treatment which will correct a really severe skin pathology permanently, which patients are not trying to get because they're scared. And they're scared of it because of the stuff they've read on the internet and on blogs and on forums. And that is one of, just recently become a more of a big issue than it has been for a couple of reasons. But it's an issue because you wouldn't see this happening for a lot of other things like high blood pressure drugs. If there was a really awesome blood pressure medicine, you would have people talking about how great it is. And if there's some side effects, they talk about that too, but it wouldn't make patients, I don't think it would make people scared to go on a drug, I think. Well, you'd hope not, but people don't talk like that about like blood pressure medicine,
Right. Yeah, well,
So,
that's the thing. And you're talking about something that could change a person's life.
And I think
they're looking in the mirror, they're afraid to go outside. They don't have that confidence in themselves, or they'll just go, okay, well, this is the way I am, and which is horrible.
Yeah, which is horrible. But not only is it people think, oh, it's the way I am, or this is like a teenage thing, or everyone gets acne. This kind of I think it's kind of downplaying the severity of it, but then also thinking, but surely it can just be corrected with an over-the-counter cosmetic product because brand X, Y, and Z sell boxes of acne clearing 5-step skincare, and then I can buy the LED mask with that, and that should be enough to clear my acne. Let me spend $800 on this, and in 3 weeks my acne will be gone. So then there's like, oh, I don't need this dangerous drug that might cause serious health problems because I can buy this $800 box of cream, and here we go. So it's a really complicated thing to, like, it's difficult to unpick, like, why is, for example, a drug like Accutane, which is an amazingly effective, very safe treatment, being vilified on social media? Is it because the skincare industry doesn't want people to clear their acne so they can keep selling them, 5-step skincare plans and LED light masks? Or is it because, I don't know, actually. I mean, to me, that's one of the biggest things. Who is propagating these myths and this nonsense? And it's worrying that not enough doctors or dermatologists are standing up and saying, listen, you guys, this is all nonsense. Like, can everyone just stop wasting their money? Stop feeding into this industry. But yeah, sorry. So yes, the Accutane is a good example of that.
And one of the other things that you talk about is in a skincare routine is a moisturizer. There are moisturizers that you get in a drugstore or whatever for $10, and then you can go all the way up to the top and spend $800 on something. Okay. And I've looked at the ingredients, and some of it is so absurd that you need a dictionary because they're saying something that is actually in the other one, but they're using a different language. They're twisting it around. And
yeah.
So what is your take on all of these different, we'll start with moisturizer.
Well, moisturizer, and I got absolutely slammed on social media when I said that all moisturizers are the same. So I got absolutely vilified for that. Surely that can't be the case. Why is something $10 and something else $800? Surely they're not all the same. I'm like, well, you hit the nail on the head when you look at the ingredients. But if you take out all the funny Latin words and the stuff you'd have to get like Google Translate out for, basically a moisturizer all moisturizers do the same thing and are the same. And this has become such a complicated world where patients come to me and they say, what is the best moisturizer? And my standard answer is the best moisturizer is the one you like and can afford, because really they're all the same. And yes, they have different textures. Yes, they feel a bit different, but it really comes down to what you like to use. I have my personal preferences with types of moisturizers for patients with specific skin problems. But if you have no specific skin problem, you can pretty much just use anything. So moisturizers is one of the, I think it's one of the biggest selling cosmetics skincare products of all time, obviously. So because they make all these promises, like a moisturizer can do everything from erase your wrinkles to remove your pigmentation, and it's just magic. But a moisturizer doesn't do any of that. They just temporarily hydrate the skin. So
I remember it was years ago. I was with a friend and we killing time, and we went into Henri Bendel, one of the.
Oh yeah.
Right. It's no longer, unfortunately.
Yeah, no longer. Yeah.
And there was some kind of new something or other. I forget what it was called, but the woman said, "Oh, would you like to try it? It does, great things for like the eye area and whatnot." Yeah. So she put it on one, and she says, "Look, don't you see the difference?" I said, "No, I don't." She said, "You're smiling." I said, "So I'm not supposed to smile so the crinkle don't go?" It was one of the most absurd
conversations. Yeah.
And then you have serums. In the last few years, you have serums and serums and serums, and every serum's supposed to do this and that and whatnot. And the serums can go for hundreds of dollars, and they're usually in little bottles.
Yeah, little 30 ml.
So what would you say to someone who doesn't, let's take away any of the acne and the psoriasis or eczema.
The healthy skin.
Right. So, and most people do have healthy skin. They might, take a look in the mirror and say, well, I have a wrinkle here, a wrinkle there. But for healthy skin, what would be just a normal skincare routine?
So a very normal skincare routine for someone who has normal skin would be to cleanse if you need to remove makeup or sunscreen, because that you don't like to have that stuff on your face. Like cleanse in the evening. So a basic cleanser, and if you have normal skin, pretty much any facial cleanser that's made to be a facial cleanser is going to be made to reduce the amount of irritation it causes. So you could use like a bar soap on your face, like Dove Beauty Bar. Yeah, if you want to. If your skin is normal, then you can do that. It's not optimal to do that because if the high levels of surfactants can remove all the oil temporarily, make your skin feel dry. But that's not like devastating to someone who has normal skin. That just means you might feel like your skin feels a bit tight when you use it. But anyway, so a basic cleanser, any facial cleanser is fine. Whatever you like to use doesn't really matter. And then, I think we do overuse moisturizer, but most people would feel weird not putting a cream on their face at least once a day. I think a lot of people, if you got out of the cycle of using moisturizer all the time, when you have totally normal skin, you'd probably be just fine. I mean, most men don't use moisturizers and they look totally fine. There's certain parts of, we know that perimenopausal women and postmenopausal women have drier skin, and as you age, your skin does get drier. So, but then we're no longer talking about normal skin. Then we're talking about like older skin that needs to stay, or that you want to keep supple and hydrated. But for totally normal skin, yeah, just a basic moisturizer. But any moisturizer will do. I prefer things that are very, very simple and basic with the less amount of ingredients, because I don't want all this random stuff in there. So I would just something as boring as Vaseline. Vaseline is one of the best moisturizers of all time. It just maintains water in the skin. It does the job. It's inexpensive. It's easy to use. All it is Vaseline and doesn't have anything else in it. There's no water. There's no preservatives. And then that's basically it. And sunscreen if you need it. And that would be pretty much the extent of a skincare routine to keep your skin healthy.
So you just mentioned the word sunscreen, and you said if you need it. We grew up with, especially in the last number of years, sunscreen should be put on all the time. You should always wear sunscreen. I'm not
Yeah.
talking about if you're not going out of the house, but you know, you should, sunscreen should be almost a daily thing you put on because you can get sun damage at any time of the year. So what is your take on that?
Yeah, so I mean, the principle, the concept, or the principle that you can UV light is all around you all the time, even on a cloudy day, and therefore your skin can get UV damage all the time, is, you know, in principle accurate, because you do have UV radiation around you all the time when you go outside if it's daylight. Otherwise, you'd have to live in a cave. Um, but I would also say that if you're only going to be outside for like 10 minutes and, you know, you're walking from your car into a building and then you're going to be inside all day, do you really need to have sunscreen on that day? You know, probably not. Sunscreen in and of itself can cause problems for some people. A lot of people just don't like using it. They don't like wearing it. Most people don't apply it correctly anyway. So even if you're using a moisturizer with SPF 15 in it, I mean, you're not getting any SPF at all. Like, there's no sun protection there. You're not applying enough of it to make it the SPF 15. So I don't like anything that's super like, you must do this all the time. I just think nothing is ever that kind of, I don't know, aggressive to me with skincare. And I don't like people to get extremely paranoid about skin either. So, because it causes so much anxiety. This sunscreen thing causes a huge amount of anxiety for people. So I like to be a bit practical about it. I'm like, listen, if you're going to go to the beach, then obviously put sunscreen on. But if you're going to use sunscreen, put enough of it on to get the stated SPF, because we know from enough clinical trials that no one uses enough sunscreen, like ever, to reach the stated SPF. So if you're using an SPF 50, you're probably putting enough on to get about an SPF 20, which means you'll probably still get UV damage when you're out and about. So what I prefer to say is, if you know you're going to be in the sun, think about physical protection. So think about wearing a hat, big sunglasses, big hat, and staying out of the sun as much as possible. You need about maybe 10 to 20 minutes a day to get enough vitamin D, for example. So, you know, usually it's the hands are enough, and that's fine. But yeah, I mean, I know that's not really a straightforward answer, but I think it's easier. It's an easier message just to say everyone wears sunscreen all the time. You know, it's a much more straightforward thing to say. It's a very easy message. It's an easy way to sell products. You must have one of these. And look at all the choices you have, you know, use something. But I think in making it that simple, we're also missing some kind of key points, which is, you know, is it really effective if you're not using it properly? Do you really need it if you're not going to be outside? You know, is it potentially drying for the skin and causing more problems for certain people? You know, this kind of issue. So, sorry.
All right. So,
Answer.
you know, we talked about normal skin, and you know, a lot of people, and I'm sure you get this question, is my skin perfect? How do you answer somebody who asks that question?
I've never had anyone ask me that. My skin. Most people say, I have so many problems with my skin, and they have perfect skin. So, and that's interesting, because I did write on an Instagram post this week, I think, it's like, what is perfect skin really? Because people do come to me and say, I want to achieve perfect skin.
Okay.
So that's something I'm like, okay, well, I don't really know what that means either. So I think, to me, if I look at someone's skin, I'm looking at whether or not their skin is healthy. So is there an obvious, and we're talking about facial skin. So is there an obvious pathology? Like, is there something that I'm looking at, I'm like, oh my gosh, you have melasma, or you have acne, or you have eczema, or you have seborrheic dermatitis, or there's something going on. So if there's no pathology, and then I look at the skin texture, I look at kind of the surface of the skin, whether it's smooth and even, and that's, to me, perfect skin is skin that is even, smooth textured, and kind of even colored, if you get what I mean.
Yes.
And then and that's basically what I'm looking for. So when I try to get patients who want to achieve perfect skin, that is the idea in my head that I'm trying to aim for. So I'm looking for a smooth texture and evenness, and the two things are very related, because smooth texture allows for good light reflection off skin, which will give that appearance of glow and evenness. So that's what you're trying to achieve when you put foundation on. That, to me, is what I'm trying to achieve with perfect skin.
Okay.
Oh, difficult
And
question.
oh, that's great. So one of the things we mentioned at the very beginning was how so many people, majority of people, are so afraid of aging, and the industry has anti-aging this, anti-aging that. Would it be better to just take a look at the fact that as you get older, you're a teenager, you probably, you may or may not have acne. I grew up with pimples. Back then, they didn't call it acne for some reason. And, there are certain things that as a teenager, as a young adult, and then when you get into your 20s, your 30s, your 40s, and so on, what is the proper course basically in your head to start thinking, and then to realistically do what you need to do, and not just be jumping off to Botox at the age of 20 or 30, or fillers, and jumping there instead of maybe realizing that it's normal. It's one thing to maybe want to correct something. It's another thing to me when people are trying to look younger.
Yeah.
That I don't understand that, because there's nothing, if you take good care of yourself. So what would your advice be?
So I start with people, if an older person, if someone in their 30s, 40s, 50s is coming and saying, I want to look younger, I kind of need to figure out what they mean by that, because, actually, I think that people, when they say I want to look younger, have a very specific idea in their head. So, for example, I had a patient say I want to look younger, and I'm like, what, I started digging around, what do you mean? What do you mean? And she said, oh, I feel like my face is dropping. So I was like, okay, well, that's not something a dermatologist can deal with. You have to see a plastic surgeon for that. So I need to figure out where they're going with that. Like, what is the specific thing you want to improve? But then if they just everything. So I'm like, okay, well, what as a dermatologist, what I can help someone with is achieving kind of non-damaged appearing skin. So one hallmark of aging is sun exposure and sun damage. This totally goes against what I said earlier about sunscreen, but so if I see hallmarks of sun damage on someone's face, and if they're like in their 50s, that's from when they were 10, and they weren't wearing sunscreen. And that appears when you're like 40, 50, 60 years old. So we're talking like pigmentation, uneven skin texture, roughness of the skin, there's no glow, things like that. That is, to me, that's optimizing what your skin would look like if you hadn't had sun exposure when you were 10. Do you get what I mean? So to me, that's not anti-aging, that's just correcting a problem. Because when I see photo damage, it's photo damage, and that's a pathology, like that shouldn't be there. So the way I kind of get patients to think about it, I'm like, well, think about what your butt skin looks like. Because if the skin on your butt is never sun exposed, okay? So if you look at the skin on your butt, it's going to be really smooth and even, and it's not going to have, unless you have like spots like acne on your bum. But if your butt is like good, or like your hips, you know what I mean? The side, right, where you were never sun exposed. Do you know what I mean? So also the inside of the arm. So if you look at the inside of your arm and compare it to the other side, you'll see a real difference in skin. So what I say is, okay, well, if you are coming to me for anti-aging, what I want to do is take your skin back to what it would have looked like if you'd never been in the sun when you were 12. And that I can do with topical treatments, so with retinoids and so on. So to me, that's like correcting the sun damage, and that's not anti-aging per se. I don't like the word skin rejuvenation either, but it would be more in keeping with that idea than with anti-aging, because I agree with the term anti-aging just is like such a nonsensical like word. Because I don't want to anti-age someone. I just want to make them look the best they can for where they're at. If you get what I mean?
Yes.
Yeah.
For where they're at. And
where they're
sun
at.
damage, yeah. Right. Sun damage. I mean, somebody in their 50s, 60s, when I was growing up, you sat out there with a sun reflector, and it was just before we really, the sun reflector, the oil, the iodine. I mean, you sat out there with that. But that was before all of the science has come out as to how harmful it is. And that's the difference. That's what people don't understand. There is a huge difference. We know we have more information now.
Yeah,
which is
absolutely.
big. The other thing is, one of your biggest things is you've said a huge part of your job is earning your patient's trust. It cannot be demanded. What do
Yeah.
you, you know, people sometimes they get a referral, they'll go to someone because somebody looks like that, and oh, look at that, look, I want to look like that. How do you go about telling people how to figure out whether they have that trust?
So, I mean, it's taking the time to talk to that doctor you're seeing and trying to see if they listen to you or how you feel when you see them. So, that post got me slammed on Instagram as well, actually. Great. I don't know why. I was really surprised at that, but anyway. And it's like I want patients choose to see me. And so usually they come and see me, they already have an idea in their head about the kind of person I am or what I do because of things like what we're doing now and
Right.
the way I talk on video. So there's already a baseline level of rapport that has been established for a lot of patients by the time they make that choice to see me. But then even in that consultation, because I'm telling them a lot of things that contradicts what they already have read on Instagram or on social media or on a blog or in a forum. Like I had a patient yesterday who she wanted to use minoxidil for hair loss. And minoxidil is FDA approved and licensed for the treatment of female and male pattern hair loss. And she said, the first thing she said was, I don't want to use minoxidil because I read on a forum it makes your hair fall out first. And I was like, oh my God. I spent 20 minutes with her already talking about her hair. I'd examined her hair. We talked about the underlying causes of her hair thinning. She was a postmenopausal woman. Why are you getting hair thinning? Let's look at everything. What's your diet like? What's your iron level? What's your thyroid function? I'd done all the medical stuff and we got to this point. And even at that point, she didn't trust me 100% because the first thing she said was, but I read on the internet that it makes your hair fall out. Why would I give a patient a treatment that would initially make their hair fall out for like 3 months? Like that, and I would have to tell her that, obviously. So it's even after that, it's so difficult to fight against the preconceived ideas that people have read on the internet, even when they choose to see me, even when they pay money to see me, even when they're sitting in front of me. The power. Yeah, I mean, the power of the internet and the power of the forums and is so much stronger. And it's such an uphill battle for me with every single patient. And I'm just saying, I say to them, listen, if you don't want to try this, you don't have to. But I'm going to give you all the information you need. I send the patients, scientific papers. They all have my email. They ask me as many questions I want. Because I'm like, listen, I will help you and I will answer these questions. I'm going to hold your hand through this process so that eventually, at the end of it, when you see that I've corrected the problem, you will then trust me. I will earn it.
And yeah, it's amazing. It's unfortunate. The internet is a hole that we could, that we wind up falling into because too much information is disseminated that it all gets so jumbled together that people start doubting their own professionals that they have gone to because they supposedly believe in them. They look at what you've done, and that's got to be so frustrating. So this, really, you're ripping your hair out. You're going to start using.
Yes, like I'm losing my hair now. but that post was written in response to all these Instagram influencers and these bloggers who are very aggressive with how they push product and push ideas without any basis to them.
Speaking of that, there was one thing, jade rollers.
Jade rollers. Oh my God, jade rollers.
Tell us what that is and why you love them so much.
I love them so much. I mean, it just makes no sense at all. I mean, the whole concept is just so ridiculous. I have no idea how someone just thought, oh yeah, let me put a jade or a piece of stone. It's not even jade because you buy them for like $2 on Amazon. These are not jade. Do you know what I mean? This has some magical properties that you can like roll. I use my chapstick jade roller to like roll, and it makes my skin so youthful. Like it's just such nonsense. And the thing is, I like to evidence-base everything. I like to have papers and trials. No one's ever done a trial of jade rollers versus placebo, for various reasons. And all I can say is with this, you have to just trust the fact that this is me demanding trust, because it's like, you know what? Like, you just have to listen to me about this jade roller nonsense. Yeah, sorry.
No, that's where we've gone to. So I'll ask you an easy question. Do you like vanilla or chocolate ice cream?
Milk or chocolate? Did you say milk or chocolate?
No,
vanilla or chocolate?
Vanilla or chocolate ice cream?
Vanilla all the way.
Yep.
I am boring. I like vanilla ice cream.
No, vanilla's not boring. Really good vanilla ice cream is not boring.
And I agree. That's a good question.
Natalia, Dr. Spierings, I thank you. I think this, I specifically didn't want to get into different, which we could do at another time, cancerous, melanoma and dermatitis, and what I really wanted to get into is, I think, the crux of a lot of what you blog about, what you believe in, and that is less is more. Not
Absolutely.
only less is more, is you have to be able to disseminate. You should not just take everything at face value. You have to really put it all together and maybe look at the thread and find in the middle there something that was so absurd that somebody just took it and rolled with it, and it's a domino effect, and then all of a sudden everyone's buying jade roller, $900 moisturizer, $1,000 serum. And isn't it enough for the fact that, we're wearing masks on our skin, probably, well, it's not in the sun underneath the mask. It could be drying out underneath there. And if you put foundation on, it's going to come out off on your mask. So, I want to thank you so much. This has been so much fun. And your website is nmkskin.com. And people can follow you on Instagram, and that's at nmkskin on Instagram.
It's actually my name now, so it's at Dr. Natalia Spierings. It's actually my name.
Oh, cool. All right.
I changed it. I changed it a while ago. My website's also now drnataliaspierings.com. It's just easier because people thought I was a skincare brand.
Oh, good.
And I was like, all right, that wasn't the point of that. But yeah, so no,
all right.
It's actually my name.
So repeat your website.
It's drnataliaspierings.com.
All right.
Easy to spell. So.
Yes, it is. And it was easy for me to pronounce. That's basically why I have everyone introduce themselves. Natalia, thank you so much. This has been so much fun.
Thank you for having me.
You can find us on all of your popular podcast platforms. And of course, our website, sylviame.com. Stay safe, stay healthy, and stay tuned.